I'm Bobby Asgar. COVID-19. Will you get infected? Since COVID-19 is new, most of the data we have about it is from China. How the virus is spreading is still not fully understood. COVID-19 can persist in the air for a few hours. On some surfaces, it can last far longer. On cardboard for 1 day. On plastic for 2 or 3 days. Disinfectants such as ethanol, hydrogen peroxide, and sodium hypochlorite are highly effective in removing the virus. Based on the available evidence, children do not appear to be at higher risk than adults. Adults have made up most of the known cases. To date, though they have contracted the virus, there have been no fatalities among those less than 9 years of age. Those with pre-existing medical conditions and those above 50 seem to be at highest risk. Those over 80 make up most of the confirmed deaths. That's not to say you're safe if you're younger. Some in their teens to 40s have died. You are still at great risk of contracting the virus. The most out and active are at greater risk in the spreading of it. Underlying conditions may leave you more vulnerable to the coronavirus. These include heart disease, diabetes, hypertension, lung disease, and some cancers. The more of these you have, the greater risk you face. The modern technologically driven age we live in hasn't helped, where obesity and ill health is widespread and the dire need for lifestyle changes is blatantly obvious, but globally ignored. You can get hit hardest when you're down. More than 30% of the world's population are obese or overweight. 10% have diabetes, but it's estimated that 46% of people with diabetes are undiagnosed. Less than 3% of Americans live a healthy lifestyle. More than 30% of Britons have sedentary behaviour, driving up rates of diabetes, heart disease, and cancer. Hospital treatment for COVID-19 may include the administration of fluids or oxygen. If patients have an additional condition, such as pneumonia, they're likely to be given antibiotics, but only to treat the additional infection and not the coronavirus itself. Painkillers and cough medicine might also be given to soothe symptoms. For those who become seriously ill, mechanical ventilation might be considered, in which a tube would be passed down the airway to help the patient breathe. Other coronaviruses, such as SARS and MERS, have shown that those who contract the virus and survive it will build a relative immunity to it. To date, there is no real substance to the suggestion that COVID-19 can be contracted twice. The true mortality rate is vague. A figure of 1% has been announced. The fact is, it's too early to say, and it'll vary from country to country. The true figure will only be realised in the virus's aftermath. To date, there have been 160,000 reported cases. Including those undeclared and undetected, the figure may be as many as 2.5 million. With 6,000 reported deaths and an additional 6,000 serious or critical, the mortality rate among reported cases might be as much as 7%. What is certain is in the past few days, the number of globally reported cases has increased exponentially. Stiff upper lips, ignorance, and apparent apathy are most definitely not going to help. Governments downplaying the seriousness of the pandemic may induce relative calm, but only in the short term. It may even delay the spread, but rest assured, spread widely it will, swiftly and with devastating effect. I'm Bobby Asgar. Be careful what you touch. Keep a distance from those you meet. Like, subscribe for more, and please, share this report.